This is Robert McMullen, MD. I'm a psychiatrist and went for medical school to Georgetown and did my psychiatry residency at Columbia, both of which places were very supportive and pleasant places to be, though you had to work hard. I've been a psychopharmacologist for over 30 years, and about 9 years ago I began using transcranial magnetic stimulation, a giant magnet. What I want to talk about today are non-medication treatments for depression, and I'll get to these magnetic electrical treatments at the end. I read a very interesting book recently called Homo Sapiens, A Brief History of Humankind by Yuval Harari. And it got me to thinking a lot about what we were like as hunter-gatherers. Humans have been around for, depending on how you count it, 3 million years, 5 million years, that we've been hairless apes. Apes, but without much hair, and also people that could run, that we can profusely sweat, which allows us to hunt and go after an animal. Out on the plains, sometimes the Indians would run down a deer, because a deer cannot run 27 miles. And there you can see the deer. The deer's not hiding in the woods because it's all prairie. Now, growing food only started about 10,000 or 12,000 years ago. A blink of time compared to the amount of time we've been around. And I like to look at how we were as hunter-gatherers to describe what we do and what we need to feel optimal. Two things that maybe are not optimal for us is eating a lot of steak and eating sweets. And those also come from our hunter-gatherer days. If we were to kill a deer, then it's really important for us to eat the whole thing that night or in 24 hours or so before it begins to turn bad. So craving it and the whole tribe or band sitting up all night barbecuing steak and eating it would be a good idea, because it's an easy source of calories because we've killed it already. We have it. And it's very nutritious because it has everything in it that we need. And with sweets, they are a very easy form of calories too. That's why the trees make them, and that's why they make them sweet, is so that animals will come by and want to eat them and then pass them off somewhere else. Maybe they'll go through, and when you defecate, the seed will still be there, so they've spread their seeds. If we came across a tree and fruit, a fig tree or a mango or whatever, it's a good idea to really crave it and to just want to eat as much as possible, because these are free calories. You just pick them up and you can just eat and eat. And then when you're just too stuffed, carry as much back to the camp for everybody else. If you decided, well, I want to go get my brother and sister and other relatives so they can come and eat it, by the time you get back, some baboons might have eaten it, or the birds, or some other animal, and there may be none left. So this is one of the reasons we crave these things. And it would actually be more healthy, it is more healthy to eat vegetables and fish and other things like that. And if I get cancer, I've decided I'm going to eat all the steak and ice cream I want. But I avoid those things now. Now, other things that happened is that people were very social. You were with the same people your whole life, their relatives. You build a hut together, you hunt together, you gather together, you help raise each other's children. It was a very close social group. And we don't have enough of that. we live in an apartment sometime, all alone, one person. If you think back, nobody lived like that. You know, even a few hundred years ago. The only person I know of who lived in a house by themselves was a witch in Grimm's fairy tales. She would live in a house way out in the middle of the woods. And that's why she lived there, because it was so unusual. Benjamin Franklin said that he was very surprised that many women, Caucasian, North European women who had been captured by the Indians were recaptured and brought back into the white society, and their English was improved and they were accepted and everything else. But so many of them would re-escape and go back to the Indians. And he was amazed at this. But they probably preferred it because it was so intimate and they were with their friends all the time. And hunter-gatherers actually work less than we do to obtain their food. They would work 4 to 6 hours a day gathering food or killing something, whereas the farmers that came after them often worked 10 hours, 12 hours, dawn to dusk. Partly because you had to be very meticulous about growing things, but partly because some people began to rule over other people, like the lords who owned the land, and you had to pay a huge proportion of what you grew to these people. So very little was left to you. Oh, by the way, the hunter-gatherers, just a couple hundred years before the farmers, were more robust. They were healthier. They were taller because they ate a varied diet. Whereas the farmers ate mostly rice or mostly bread, whatever they grew. The hunter-gatherers didn't take vitamin pills because they ate a varied diet. They'd get up in the morning, they might push over a palm tree and find the grubs that were in the roots. They might eat some forms of insects. They would forage and find tubers. And I saw an Aborigine lady, or she showed us one tuber they would gather, and you'd see the leaf and you'd know what it was, and then you'd pull it up and it was like a thin carrot. So you'd have to do a lot of work to collect a lot of those. Part of the reason that people craved eating a lot of fruit and steaks. Now, some other things that are relevant is that we used to make a lot of vitamin D, and hunter-gatherers, what were they going to wear in Europe? They could wear fur or leather, or they could weave something from plants. They didn't have wool or cotton. So they probably wore about as much as all the Aborigines that still live in South America and Africa and Australia. They probably wore about nothing. And maybe they wore a little to cover the genital parts or something. So they were making 10,000 international units a day probably. And if you really work at it, you can make more than that. So we evolved to need that much vitamin D to efficiently run our body. When humans came out of Africa and went into Europe, they were dark-skinned and they couldn't be healthy enough because the dark skin blocked the UV light and they couldn't make enough. So they very soon evolved a whiter skin, and the Swedes evolved a whiter skin than the Italians because they had to make a lot of vitamin D in a short summer, and often the sun, even in the summer, is not that high there, so it has more atmosphere to come through, so it blocks out more of the UV light. And vitamin D is not a major player with depression, but it seems to be a small player, and it's a major thing for health.
So for the diet, what you recommend, and do you recommend to take vitamin D supplements for depression?
I think that if the hunter-gatherers didn't need vitamins, then we don't either, as long as we eat a varied diet. There was a big study recently, and it looks like it's almost certain that taking a multivitamin slightly increases your risk of cancer. But much worse than that, it makes the cancers more aggressive. So if you happen to get a cancer and you're taking a multivitamin, you're feeding it what it needs to grow fast, which is mainly folic acid and B12. So therefore, it's more aggressive. The only vitamins you really have to test, and you should do this every few months or once a year, tell your internist to put in a B12 level and a vitamin D level. Now, vitamin D is actually a steroid hormone. It's not a vitamin, but it's often low because we're not in the sun. And B12, for some reason, is fairly common, maybe 1 in 10 people. And so if that's low, then you add that in. And when B12 is low, it contributes to depression. But you just don't want to take a B complex because that would include B12 and folic acid and make cancers more likely. And the experts in this say if you measure all of our other vitamins and minerals, they're pretty much all sufficient if we eat a varied diet.
And
now,
what about omega-3?
Omega-3 is really important, and this helps depression, and there's studies to show this. And one of the reasons is that omega-3 and omega-6 were more or less equally balanced when we were hunter-gatherers. And now we overwhelmingly have omega-3 in our system, maybe 10 times as much omega-3 as omega-6. And the omega-3 is more important for depression. And this is apparently because brain cells are 45% made of omega-3. So it's a cell, like a room, and then the fluid and the nucleus and everything is in the middle. But the walls of it are 45% made of omega-3 if the brain can get enough. And with this high amount of omega-6, it's forced to use omega-6 as the blocks. Omega-6 is found in a number of things, but especially corn oil. And corn oil now is in everything. Muffins, it's just in so much of our food is spiced with corn oil. Back then, people didn't have corn oil, and so the fats they ate were a little bit of both. And if they ate brains of an animal, if they killed some animal and ate the brains, then that contains a huge amount of omega-3 because their brain is made exactly like ours, but a deer or a giraffe can make its own omega-3. They can make it. If we may be able to make a tiny amount, the scientists think, but not enough to matter.
So how many units do you recommend to take a day?
Oh, that's a good question. There's a brand of omega-3 called OmegaVia, which is all EPA. There's two fats, EPA and DHA, in fish oil and mainly in fish oil. And it's the EPA that helps depression. And in recent years, they were able to separate this at not a huge expense. So you can get a 500 milligram pill of OmegaVia, and I'm certain of other brands. And then you're taking more of the EPA in a smaller pill than you have in a larger pill. But whatever people take, I say, whatever pill they take, I say take 5 to 10 pills, preferably 10 pills. The way I figure that the amount they were using in the first study by the amount they said of omega-3 and omega-6 was about 18 pills a day of 1,000 milligrams. That's hard for me to believe, but one of the first people I put on it is on 18 pills per day for 20 years now. And he's fine. And every time he reduces it to 10, we've tried a few times, he immediately goes into a mild or moderate depression which goes away as soon as he restarts it. So there may be a lot of people that would respond well to 18 pills. But try to get someone to take that much. It's a little difficult. But I think that maybe somebody who is taking it should 1 week take 18. Take 9 in the morning, 9 at night, or split it up so it doesn't seem like such a gigantic amount. Now, exercise. There was a study where they took half of people that were very depressed and made them exercise for an hour. And they had trainers standing over them, making them exercise. It's kind of hard to do it on your own when you're depressed. And the other half went into the building at the same time and were in a room where they were taught yoga. The people who did the exercise had a very significant antidepressant effect, as good as Prozac. They did this 1 hour per day, 5 days per week, and it was fairly vigorous. So for depression, it's a good idea to do 5 hours per week, not all in one day. It should be split up. Somewhat vigorous. If you can't do it vigorous, then just walk. But try to go up and down hills and try to do more than 5 hours. And back thousands and thousands of years ago, we did a lot of exercise. We were constantly doing things all day long. And I remember my grandmother, how much she worked before washing machines came in, I think in the 1930s. And she was just always washing things, hanging them up, canning food, carrying wood for the fire. They just worked all the time. And our body is designed for that. And if it wasn't designed for that, we wouldn't be able to run marathons. There's something else I'm very embarrassed about that I just learned this recently, is that sound is an antidepressant. And there's some studies that show this, and they were double-blind studies and so on. The sound should be about the same amount of volume as a conversational voice, which is 65 decibels. You know, it could be a little higher. And it should be on most of the day. I see it that probably having no sound is what makes us depressed. Again, long ago, people lived in a band all together. There were babies crying, there was children running around playing, there's people sitting and talking, there's people squashing food, there's people using primitive axes. I actually have 3 of them, and which are amazingly hard to make for modern humans, and they're very efficient and sharp. But these things made noise. So you were constantly in noise, reminding you also that you're with your family and your extended family. So sound helps. I saw somebody today, and when she's not watching movies on TV, it's completely silent in her house. And so if she's putzing around doing various things and cooking some food, it's completely silent. And that's a bad idea. I would either have the TV on or music or radio. There was a very interesting book written by Francine Cornos called A City of One, and she was orphaned in her early teens, and it's quite an interesting book, you know, of what she overcame, and she became an internist, and later she became a psychiatrist and was very important at Columbia. And for 1 year, she really stopped socializing. She just kept to herself more for various reasons. And during that time, she just had to have noise. She'd have the TV on and the stereo. She'd have 2 or 3 things on, and to constantly have sound. In a way, see, that was an antidepressant effect. Now, what else?
Pets.
That's enough on those things.
What about pets?
Pardon?
Pets.
Pets. Oh, pets are a very good thing, just
Maybe
because
what?
we're social, and the pets are social. Parrots are good because they're very social. If you have a parrot, they are going to do terrible unless you spend 2 or 3 hours with them. They really need a lot of time. And if you're not going to spend that time, then you really need to get 2. And it's the same with sugar gliders. a small primate-like animal from Australia. And the best pet is a dog, because the dogs are exactly like us. They socialize. They were always in a group. The difference in their group was there was one dominant person, and in our groups there apparently was not. There might be a few people that were more dominant. It was sort of group decisions about where to go and what to do. But dogs always want to be with you. And sometimes it's better than being married. If you don't take a bath, they don't care. The later you come home, the happier they are to see you. If you want to go someplace, they'll love it. They'll go anywhere you're going and be happy with it. So they're the best, I think. And cats are okay, but they're really loners. Almost all cats except lions are loners. They live alone, they hunt alone, and don't have any social contact except with their offspring or when they mate. Now, some other things. Light. Light is also important, and that's also from thousands of years ago. The best light therapy is to get up early in the morning and get a very bright light box and put it in front of you and be really close, like a foot away. It has to be 10,000 lux. If you put your nose on the window, and I've measured this, and it's a pretty bright day, maybe the sun isn't directly on the window, but a fairly bright day, you're only getting 5,000 lux. So it has to be a very high amount of brightness in order to get an antidepressant effect, and you'll feel it in 1 week if you do it a half an hour every morning. And then if it works, you can try to cut it back a little. It's very hard to get people to do this. And there's another thing you can do is have a dawn simulator. Simulates dawn, the light coming up in the morning. And this organization that's sort of a nonprofit, www.cet.org, Center for Environmental Therapeutics. They have a dawn simulator and other things that help out depression.
Can you use sunglasses?
Sunglasses?
Yeah, when you do the light therapy?
No sunglasses. You have to have totally bright light come in through your eyes. And this is not the same as making vitamin D. This has not, completely different. This has just to do with bright light and not ultraviolet light. If you walked across England in the 1300s or 1400s, you would see nothing. There was nothing there in the winter. And that's because everybody was in a hut. And they brought all the animals into the hut, the sheep and everything else, because otherwise the wolves would get them. And they would all sleep there, and that would give them extra heat. And they'd sleep under mattresses. And people would just sleep as much as possible. And then when the spring came, they'd be outside, and the bright light would bring them up, and they'd get energized and ready to plant the crops or whatever they did. It's sort of a form of hibernation. And many of us that suffer with depression have that type of depression where we sleep 12 hours, 18 hours when we're depressed. And that's sort of the hibernation type experience. The getting a lot of bright light in the evening turns out to help a little. Not nearly as much. And if you get bright light in the morning and in the evening, that's worse. It's kind of a negative. And if you cut off the last half of your day, a friend comes by and picks you up and says, let's go fishing at 3 a.m. or 4 a.m. You get in the truck, you're really tired and miserable and hard to wake up, and you go 2 or 3 hours, and then you get out on a little fishing boat, and you're fishing. And then around 9 or 10, you're feeling great. The reason you're feeling great is not because you're with your friend and talking about old times and so on. It's because you cut off the last half of your sleep. And when you do that, it lifts your depression just for 1 day, but it's very dramatic. It's very hard to use that for treatment, but some people have done it by having the patient cut off the last half of their sleep or not sleep at all for a whole night. And then the next night they're allowed to go to sleep when they want. But they do this every other day for 3 days, and then they try to cement it in that they're going to bed earlier every night, like 9 or 10 p.m. and sleeping 8 hours and then getting up. And when you move your sleep cycle earlier, that's the trigger for spring. That's what tells the birds in the south to fly north. That's what tells foxes in the Arctic to start having brown fur instead of white. Now, if you could combine the light and the exercise, if you get outside early in the morning in bright light and just walk, but don't do it under trees, have the whole sky up. Or sit and read a newspaper. Just don't read it like this. Have the sky up there to fill in most of your visual field. And if you get up early in the morning, rather than lay there in bed and suffer, get up and go do something, and maybe even just watch television. But it would even be better if there's any light outside to go outside, or to get under a light box. You can buy your own light box. It's just the neon lights in the ceilings. You just stack 2 to 6 of them together like that. Another way you can use light is just obtain a timer from the hardware store and put a very bright light next to your bed coming down on you. And then have it go off half an hour before you want to wake up, or an hour. And that light will go on, and you'll hate it. You'll move away, you'll put the sheets over your head. Doesn't matter. That bright light has a huge effect on suppressing your melatonin, your sleep hormone, which is about 0 during the day. And that helps depression, and that's very inexpensive. Another thing is to avoid negative thoughts. If you've just gotten in contact with an old girlfriend from 20 or more years ago, and you start corresponding and you find out all these things that happened that you should have done differently or that you didn't know of, and this is why you broke up, and you're thinking about all these things and putting everything together, all of those negative thoughts just make you more depressed. And you can just stop them. A psychologist said, why are you torturing yourself? And the fact is, often you are working at thinking about these things. Just stop working at it and just don't do it. It's easier than you think. And try to reframe things you do and look at it in a more negative way. There's nothing good or bad, but thinking makes it so, from Hamlet. If you fail an exam, you're taking the exam for fire chief in the fire department, or you're taking an exam in your specialty of being a gynecologist or something, and you fail it 3 times before you pass it, or fail twice before you pass it on the 3rd time. Now you could say, I'm embarrassed and humiliated. If anybody knew that I failed this and had such low grades the first 2 times, they would know I'm not very smart. And I've always known that I was not very smart. And I'm a worthless human being because I couldn't get myself to study the first 2 times. You look at it differently and say, I finally passed, that's great. The extra work was worth it. Maybe I learned more by having to do it 3 times. And I didn't do so well because I didn't try so hard the first couple times. I was a little depressed. It was just hard to get going. And I could have passed it if I just could have had the energy. And then you cultivate other positive emotions, being joyful, gratitude, having interest in things, getting hobbies. Another thing is to take the rule from AA. Accept the things we cannot change. Have the courage to change the things we can, and the wisdom to know the difference. People should get a genetic test called the MTHFR test, MTHFR. And that is a genetic test that has to do with the folate and B12 system. 1 out of 5 of us are abnormal, or quote abnormal in this, and that predicts that taking the real folate vitamin will help your depression. rather than folic acid. Folic acid is not found in our body or in nature. The vitamin companies make it because most of us can convert it to the active one. NAC, N-A-C, N-acetylcysteine, is an amino acid. I won't get into all the details, but it basically helps your body clean out the poisons. It allows you to make more of the substance, glutathione, that cleans out free radicals, and that helps depression. Michael Berg started out with 2 grams of that per day, and it had a positive benefit, but it took months. And the dose should really be 4 grams per day, and he's done subsequent research to prove that. And then taking vitamin D, as I mentioned, the dose is 1,000 milligrams for every 25 pounds. So a 100-pound person should take 4,000 a day, and if you double that, you need double the dose. SAMe is a chemical that's endogenous to our body. We make it, but taking it often helps depression. It's a little expensive. Magnesium in a large dose, like 400 milligrams twice a day, sometimes helps, and there's studies on this, but I have never had anybody respond. Sarcosine, S-A-R-C-O-S-I-N-E, 1,000 milligrams twice a day. It's hard to obtain and it's expensive, but I had one home run with it where somebody did really well. Avoiding alcohol, avoiding substances that stir up the brain like cigarettes, marijuana, cocaine, ecstasy. All of these, for various reasons, make your depressions worse. About the sleep. If you could possibly not allow yourself to sleep more than 8 hours. If you want to become depressed, just try hard to sleep 12 or 11 hours a day, and within a few days you might be quite depressed. A Mediterranean diet is a very good thing. Vegetables, fruits and nuts, fish. These are the same types of things we used to eat. Now, the electrical stimulation treatments are very varied, and they probably work for different reasons. Shock treatment is a huge amount of electricity going through the brain, causing a grand mal seizure, and maybe it just resets a whole bunch of neurons. I'm not sure how it works, but it works, and particularly in people that are delusional when they're depressed. The alternative is TMS, transcranial magnetic stimulation. And also, let me just mention about TDCS. This is transcranial direct current stimulation. It runs electricity from one side to the other. And there is a Fisher-Wallace device that does this. And I've had some good results with it. It cost about $800, but if you return it in 2 months, within 2 months, you get 90% of it back. So it's really a no-brainer to try it. There's other machines that do the same thing, and I used to use a different one from Canada, and there was more things you could do with it. But I had a very poor success, partly because it was very hard to get people to do this every day for 30 minutes. The first patient did terrific, no benefit at all, and then on the 30th day, her mood lifted. Then she had a funny taste in her mouth, and she stopped it a couple of days, and then went back on it. And then she lost the benefit, and she just didn't want to go through another 30 days. A couple of years later, I got her to do TMS, and that's changed her life. One other sort of electrical thing is a negative ionizer. This is what's used to clean the air with, and electrons come out, and they found this because certain winds, like the Santa Ana wind in the southwest and the Föhn in Switzerland, caused people to be very irritable and depressed, and it turns out those were full of positive particles. So someone thought that negative particles would work. And you buy a machine, a really powerful one, and you put it a yard away, and you just sit there for half an hour a day or longer. And you can also get this at the wwcet.org place. They have the most powerful in the world, so you don't have to ground yourself to it. Now, the TMS is a huge magnet that's very strong. It's just like an MRI, the same principle that you run electricity through a copper coil in a burst, and that causes the coil to become a magnet. And then when the magnet goes on and off, it either stimulates, usually on the left side we'll use it to stimulate brain tissue under there, to just discharge more easily. Or we use it on the right to inhibit discharges. And either one of those help depression, and they're about equal in efficacy. If you do both sides, it's not much more beneficial than just doing one, but in some people both sides does work better. There are also new ways. There's an explosion of research in this area. There's other ways of treating the depression. You can do inhibitory on the right orbital frontal cortex. You can do excitatory treatment on the dorsal medial prefrontal cortex. And then there's a place here that you do an inhibitory treatment, the pre-SMA, and that's for OCD, but it also can be used as an augmenter of the regular TMS. There's another machine called a Brainsway that was developed in Israel by Yiftach Roth, a physicist, and it's a helmet, and the copper coils are in such a orientation that the magnetic field goes 6 or 7 centimeters into the brain rather than just 2 or 3 centimeters. It hits a much larger area, and it seems like it may work better than the standard figure 8 machines, but I think the standard figure 8 machines are close. I have both machines. Oh, let's see, a couple of things I left out. One thing is volunteering. And this, of course, is often done by people that are retired. And it makes you feel much more positive. You've got a whole group of people you know well. It's very satisfying, and it's very good for depression. It's also probably similar to the way we were long ago of helping each other out. And having more religiosity, going to synagogue or a church or whatever, or a mosque more frequently, and being involved in religion, that helps. And spirituality of any sort. And of course, maintaining a lot of family relationships. Go visit family you've hardly seen before, or even you've never met, and spend time with them. And spend time with just one of them at a time, so you really get to be friends. Anything else that reduces stress is good. You know, our response to stress long ago was just momentary or very brief. If we came across a poison, was and is extremely common in Africa, then you'd have an enormous stress reaction and take off. And you release all these hormones. Or if you're walking along with a friend and you hear some lions or elephants in the distance, you might make some noise to keep them away, but you'd be under enormous stress. But this didn't happen every day. It might happen every few days. But now we have stress all day long. We're working in an office, we get a phone call, we have to deal with this, we get another phone call. It's just stress, 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 raising all these hormones, adrenaline, cortisol, and so on, which contribute to depression and contribute to more heart disease and everything else. So anything you can do, from exercise to yoga or something, to reduce stress is a good idea. Okay,
Thank you very much, Doctor, for your great tips. So you suggest people to use all your tips, some of your tips, or
It's hard to use them all, but if you could, it would be good. And I think that some are pretty easy. You know, you should be on the vitamin D. Vitamin D reduces cancers about 70%, breast cancer and colon cancer.
and omega-3.
Pardon?
And omega-3.
And omega-3s is easy to do. Having sound in the house is easy to do. If you don't have any friends and you live in a city, that's a problem. It's hard to make friends in a city, I know. And you should still make the effort. And make the effort to stay in contact with people. And a friend of mine got divorced, or not divorced, but he was separated. And it was, anyway, I won't get into the details, but he would call me every week. He'd ask if he could do that. And with all his friends, he would arrange to call and talk for half an hour or so weekly. And this was to keep his mood up, to have people he could relate to and socialize, even if it was on the phone.
Or maybe, like you said, volunteering is also good.
Yeah, volunteering is good because you'll maybe make some friends there. People you go out to coffee with, people you spend more time with.
Text is easy.
Yeah. And exercise is easy if you make it a regular part of your day. I can't stand gyms, but gyms are good. You know, you exercise hard. And if you can only do 20 minutes, that's good. And just try to do it with a lot of effort.
To combine as much tips.
I would combine as much of these things as you can because none of them are that hard to do. You just have to set them up, like setting up the light to go off your bed. You know, you go to the hardware store, you get it. You get a bright light or one of the lights you have, and you put it next to the bed and you have it go off. You do it once and you've got it. Even if you put a light next to the bed that's not as bright, if you could possibly force yourself when it goes off to look at it, to turn over and look at it, that light will just gradually wake you up. And it could have a significant antidepressant effect.
Thank you very, very much, Doctor.
Okay,
For the lecture. Thank you for your time.
no problem.